Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course,
We're going to
Bob.
show you some hip stretches in the bed and chair. You do the bed.
That's
and
right,
I'll
Bob.
do the chair.
I'm going to go to bed. Okay, you can do these in the bed. You can do them on the floor as well if you'd like to. We're going to do them here on
Just
the plinth.
plain hip flexion to start out.
So we're just going to start out. Just grab one knee like this over the top and pull that knee towards your chest. All these stretches, make sure you breathe and relax with these. And if they create any pain, particularly sharp pain, stop. You do not want to continue with that stretch.
Now,
And-
also, if you feel that you don't need that stretch, don't do it. Just do the ones that you feel are tight or
Right.
needed or painful.
Yep. Check one leg and then the other one, and that'll let you know. Is one side tight? Work a little more on the tight side. Like this stretch, I have no problem with. I don't do this stretch because I have plenty of
Right.
flexibility.
I don't either.
Right.
Figure four.
Figure four. This is one I do, and I do like it. It feels like a good stretch. I'm going to take.
You can do it with the leg down, too.
Yep. So the ankle goes just above the kneecap on the thigh, and on this one you can just let gravity go down or add some pressure. All of these we can go pressure on, pressure off, 5 to 10 repetitions, or you can hold it 15 to 30 seconds, depending on what feels good for you. And then up here,
Yeah, a little more intense.
this is the way I do it. I go like this, and I put some pressure on there, and it feels good. There's no pain. Feels like I'm doing some good in that. And this is one that helps you put your socks on and shoes on.
Right.
Some people are having. And then, do we want to do the?
Sure.
This is
Give
for
me the
the real aggressive
Advance.
people. Yeah. A lot of people will not do this one. I usually don't go this far advanced. All right. What's the next one, Bob?
Brad, is internal rotation with overpressure.
This
You
is,
probably need this one because your hips tend to turn out a little bit.
Yeah. So here, I'm going to stretch this one. I'm going to take this leg, go over, and the job for this leg is to push that knee
way,
this
yep.
way. And I'm stretching that. And this gets that piriformis muscle, gets the hip. It's a nice one. Even gets a little low back in there.
Probably IT band a little bit, huh?
I think you're exactly right, Bob. We got to do that.
For once.
We got a video on the IT band, a new one that we got to get after. Okay. And that's next.
All right, next one is frog feet.
Oh,
You can do it two ways,
okay.
and one
So,
I think Brad kind of invented.
well, I don't know about that, but you can put your feet together,
Right.
bottom of the foot to bottom of the foot, and you can start out and do the clamshell, but then you want to work into, if you can reach, your shins, go up and pull, and I use my forearms to actually push my knees out, pull my feet towards me.
Well, I actually cross the ankles.
Yep, that's a
That's
good way
what
to
I-
start it. If just like this, and
Yep.
it's not as aggressive, and it's a little easier to grab. That's a great way to start. I'm glad you brought that up, Bob.
All right.
Breathe.
How
Oh,
about the hip flexors, Brad?
oh yes.
One leg off the bed.
This is nice
Got
because
to be careful. Don't fall off the bed.
yes, shoulders stay on the bed, hips go to the edge of the bed, allowing this is the leg getting stretched. And we'll just let gravity take it away.
For a lot of people, that's going to be enough.
Yeah. If you want more, we've got another video where you
Well,
can use
if you
a
want
strap.
more, you could also pull this leg towards you.
Good. I'm glad you thought of that, Bob. Yep, that helps.
And you can see, actually, when he does that, the leg comes up a little bit because he really is stretching on the hip flexor, which runs along here.
Yep. Then that works the other side too. It's a good win-win situation. Dude, all right, that was
All
fun.
right, next one. We're just going to show you 3 stretches you can do in a chair. So if you're at the office and you want to take a break,
Yep.
you can slide your butt forward,
Ooh.
and you're going to go ahead and work on the hip flexion.
Yep. Now sometimes I'll actually go up and pull it across
Sure.
a little bit. It just gets a little
Yep.
different muscles in the piriformis muscle.
All right, then figure 4, where we just put the ankle across the other opposite knee, and you can actually lean down too if you want, but you can press down using your palm of your hand. Feels good, doesn't it, Brad?
Oh yeah. Again, like my mother, she's 80, going to be 86 now. She has a hard time getting her leg to come up and over, and that makes it a real challenge to put your
Right.
shoes and your socks on. So if you do this and continue with it, you'll maintain
You want to
that.
stay ahead of the game. on that one.
Exactly.
All right, the final one, Brad, is actually you start a figure 4, but then you bring it this way and stretch that way, and you
Like
really
this.
feel that in your hip.
Oh, yeah.
It really. I don't know if you feel it in yours, but I really feel it in mine.
Yeah. And then you rotate, you get a little bit
Yep,
of low
and then
back
you rotate
in
a little
there.
bit. Yep.
Mm-hmm.
That's it, Brad.
That's it.
Bed and chair.
Excellent job. Nice work, Bob, and good luck with your hip and your chair and your bed.
Bed.
Get it all together. You know what I'm saying?
You're rambling.
Stretch away.
You're rambling.
Carry on. Thank you.